Soon after Heather Eldebs gave birth to her firstborn son, she noticed something wasn't quite right.
I'd lost my appetite and I was not sleeping and just not seeing any joy in life at all.
The Toronto mother was diagnosed with postpartum depression and anxiety, a battle she would have to face a second time after having her daughter.
It's just a cycle of feeding, crying, eating, sleeping. And when you experience any sort of even mild anxiety, depression, sometimes you feel very trapped and isolated.
Okay. And for those becoming parents during a global pandemic, that isolation has been amplified. A study published in the Canadian Medical Association Journal reveals between March and November of 2020, mental health visits during the first year after giving birth were 30% higher than pre-pandemic.
That's quite concerning to us.
Psychiatrist and lead author Dr. Simone V. Good says a lack of social support plays a large role.
So they didn't have even breastfeeding clinics, peer support groups, public health nurses visiting.
Having someone just take your baby for an hour so you can get away, go shopping, all of those things that are so key to moms in those early days.
While COVID-19 may have cut off much of our in-person communication, it has allowed for some flexibility. In April of 2020, online appointments increased to 85% from just 3% in 2019.
While virtual care has certainly been a silver lining, I do think we have to remember that there is something that people are calling now the digital divide.
VGOD said that the study found that those living in lower income neighborhoods did not see an increase when it came to mental health visits. A gap in access and affordability, she says, Canada needs to fill moving forward. Mauracher, Global News, Toronto.